Welcome. What is MERS? Middle East Respiratory Syndrome, also known as camel flu, is a viral respiratory infection caused by the MERS coronavirus. Symptoms may range from mild to severe. They include fever, cough, diarrhea, and shortness of breath. Disease is typically more severe in those with other health problems. Mortality is about 1/3 of diagnosed cases. MERS-CoV is a beta coronavirus derived from bats. Camels have been shown to have antibodies to MERS-CoV, but the exact source of infection in camels has not been identified. Camels are believed to be involved in its spread to humans, but it is unclear how. Spread between humans typically requires close contact with an infected person. Its spread is uncommon outside of hospitals. Thus, its risk to the global population is currently deemed to be fairly low. As of 2020, there is no specific vaccine or treatment for the disease. A number of antiviral medications were being studied. The World Health Organization recommends that those who come in contact with camels wash their hands frequently and do not touch sick camels, and that camel-based food products be appropriately cooked. Treatments that help with the symptoms may be given to those infected. Just under 2,000 cases have been reported as of April 4, 2017. About 36% of those who are diagnosed with the disease die from it. The overall risk of death may be lower, as those with mild symptoms may be undiagnosed. The first identified case occurred in 2012 in Saudi Arabia, and most cases have occurred in the Arabian Peninsula. A strain of MERS-CoV known as CoV-MC/2012, found in the first infected person in London in 2012, was found to have a 100% match to Egyptian tomb bats. A large outbreak occurred in South Korea in 2015. A further outbreak of MERS was reported in 2018, affecting Saudi Arabia and other countries to which infected persons traveled. But from the years 2015-18, the number infected in Saudi Arabia in 2018 was the lowest. Signs and symptoms. Symptoms of MERS. Early reports compared the viruses to severe acute respiratory syndrome, and it has been referred to as Saudi Arabia's SARS-like virus. The first person, in June 2012, had a fever, cough, expectoration, and shortness of breath. One review of 47 laboratory-confirmed cases in Saudi Arabia gave the most common presenting symptoms as fever in 98%, cough in 83%. Shortness of breath in 72% and myalgia in 32% of people. There were also frequent gastrointestinal symptoms with diarrhea in 26%, vomiting in 21%, abdominal pain in 17% of people. 72% of people required mechanical ventilation. There were also 3.3 males for every female. One study of a hospital-based outbreak of MERS had an estimated incubation period of 5.5 days. MERS can range from asymptomatic disease to severe pneumonia, leading to acute respiratory distress syndrome. Kidney failure, disseminated intravascular coagulation, and pericarditis have also been reported. Virology. Middle East Respiratory Syndrome is caused by the newly identified MERS coronavirus, a species with single-stranded RNA belonging to the genus beta coronavirus, which is distinct from SARS coronavirus and the common cold coronavirus. Its genomes are phylogenetically classified into two clades, clades A and B. Early cases of MERS were of clade A clusters, while new cases are genetically different in general. The virus grows readily on Vero cells and LLCMK2 cells. Prevention. While the mechanism of spread of MERS-CoV is currently not known, based on experience with prior coronaviruses, such as SARS, The WHO currently recommends that all individuals coming into contact with MERS suspects should wear a medical mask, wear eye protection, wear a clean, non-sterile, long-sleeved gown, and gloves. Perform hand hygiene before and after contact with the person and his or her surroundings, and immediately after removal of personal protective equipment. Treatment. Neither the combination of antivirals and interferons nor corticosteroids improved outcomes. When rhesus macaques were given interferon alpha-2b and ribavirin and exposed to MERS, they developed less pneumonia than control animals. 5 critically ill people with MERS in Saudi Arabia with acute respiratory distress syndrome and on ventilators were given interferon alpha-2b and ribavirin, but all ended up dying of the disease. The treatment was started late in their disease, and they had already failed trials of steroids, so it remains to be seen whether it may have benefit earlier in the course of disease. Another proposed therapy is inhibition of viral protease or kinase enzymes. Researchers are investigating a number of ways to combat the outbreak of Middle East respiratory syndrome coronavirus, including using interferon, chloroquine, chlorpromazine, loperamide, lopinavir, remdesivir, and galidesivir, as well as other agents such as mycophenolic acid, camostat, and nitazoxanide. Using extracorporeal membrane oxygenation seems to improve outcomes significantly. Thank you for watching this video. Goodbye.